it feels expensive compared to 5 years ago. I think for the borrowing costs increasing and some of the construction costs and labor costs increasing over this time period, I do think there's definitely an element of, replacing a hospital is now more expensive than it was 5 years ago. But I think what we've done on the capital side is we have gone through and done an assessment of all our deferred assets, age of plant. Some of that has, as a CFO, that sometimes that gets complicated with purchase accounting and when you acquire different facilities over time. But what we've done is we've really gone through, done an inventory and assessment of all the major assets. And we really have identified the pockets of challenges where the age of plant is high. So what we're trying to do is to direct our capital funds and into those areas, and knowing that sometimes routine investments, like for example replacing equipment, is okay, but in others it's not. And we have, for example, announced that we are replacing our hospital in the southern market of Pittsburgh, so it's called Canonsburg. We are building a new Canonsburg Hospital, or AHN South. And that, right now we're in, working to identify the right location and what the services are going to be. But I do think that back to your comment and question is, yes, it is more expensive. And yes, things are a bit more digital. And we need to be really focused about the services that we're providing. And it's not just being digital too, the site of care is also changing on where patients are receiving care. So we have to incorporate all of that into the design and ensure that it's going to meet the community need, meet the patient's need, provide some level of financial return for us, and replace the plant that we have, the facility that we have today. But it is definitely a fine balance. I would say last comment on this is that we do need to be forward-looking in what we're designing there, because we do know that some of this will continue to change. Just building the same facility at a different location that we have today is probably not the right answer, given how much things have changed around the digital footprint, the site of service, and really the market and the demographics that we're looking at, even in that specific hospital I mentioned.